I'm Rodney Schutt, President and CEO of Orion Innovations. Johns Hopkins published a study pre-COVID that states approximately 250,000 patients per year die from medical errors or medical mistakes, which is the third leading cause of death in the United States behind cancer and heart disease. Post-COVID is the great attrition. Global statistics say that somewhere between 19 and 21% of all nurses left the workforce. So that makes a very complicated job as a clinician, especially in critical care, even more difficult. Why? Because we now have more nurses that are finding their way into critical care departments that may not have as many years of training that we had prior. In 2022, there were over 1.25 million serious infusion adverse drug events that led to approximately 175,000 deaths. In addition, around 60 to 90% of all IV infusions in the United States contain one or more errors. 56% of all adverse drug events are infusion related, and 26% are life-threatening. Think about the average length of stay for an ICU patient, somewhere around 3.5 days. And think about the infusion nurse that on average comes in and administers 17 or more additional drugs in a 24-hour period, on top of all those other lethal, life-saving drugs that are already hanging and going into the patient. They stand 30, 35, 40% chance over the course of an average length of stay of making a mistake. And they do. Every hospital, every health system across the globe, this mistake is made multiple times a day. And if they're lucky, it just leads to an adverse drug event, a drug-to-drug collision that they can reverse. Infusion confusion is the main cause in medical errors in the acute care setting. In plain terms, infusion confusion is a tangled mess of IV lines that causes complications to patient safety. The Infusion Nursing Society has moved forward over the last couple decades in a protocol and a standard of care around infusion line identification. And the current standard of care is either pre-printed labels or tape. Well, this in theory works, we'd think would work well because all lines have different labels. However, in the ICU, because of the delirium setting, they prefer that the room be dark. So in a dark room, those labels really don't help. So how do we provide a simpler, safer, more effective way? And how do we help the healers heal? So MedLite ID is the solution. MedLite ID is our patented smart, simple, disposable lighting system to identify the saline line efficiently and accurately. The product itself are 3 small, disposable, permanently attached lights attached to the saline bag line. They are wirelessly connected through 128-bit of encryption. They have a soft button on all of them, and they are only attached to the safe line. With MedLite ID, the workflow is actually even more streamlined. Now, instead of a complicated, error-prone process of tape and labels, they simply rip open our pack, pull, 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 clip, 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 and now MedLite ID is permanently attached to the saline bag safe line, which virtually eliminates the possibility of them creating an adverse drug event. Well, clinical evidence is one of our key pillars across Orion Innovations, and certainly MedLite ID. And a recent clinical study performed by Wake Forest has recently been peer-reviewed journal published by the Journal of Infusion Nursing that demonstrates the overall productivity, efficiency, safety aspects of MedLite ID. Conducted at the Wake Forest University School of Medicine, the study represents the first test in an American hospital that proves the effectiveness of MedLite ID. The research was conducted at the High Fidelity Simulation Suite at Wake Forest University School of Medicine with experienced intensive care unit ICU nurses. When compared to standard labeling practices, MedLite ID was 24% faster in accessing the primary medication line injection port and 40% less mental tasking as quantified within the study. The MedLite ID research has further been validated by a 4-month study at one of the largest VA hospitals in the country in Houston, Texas. One output, which was also validated by Wake Forest, is a 400% improvement in time to port. One of the other applications worth exploring that has been highlighted to us is oncology. So the question would be, in oncology, can we deliver a multi-light solution where there are 3 MedLite, different color each line, across all lines in oncology? And the answer is clearly yes. Well, our Gen 2 and Gen 3 product does that exactly. It's working prototypes that are ready for clinical testing. And if we truly are focused on helping the healers heal, we have an obligation to seek out additional products and solutions that first think of the patient, then the clinician, and certainly they must have an economic driver for the hospitals and tackle the ever-growing cost of healthcare.